My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, it's Dr. Rick with Herbal 411. Bharat had a question about low body weight. I call it being too skinny. I used to hear this all the time. You're always so skinny growing up. And that was probably in middle school, early high school. Usually it would be relatives and or my mom. And that's okay because in the 70s and 80s, we didn't have obesity. So I guess people that were skinny got picked on, unless you were morbidly obese. And that's, again, in the 70s and 80s. If you ever watch the CDC's or look at the CDC's progression of obesity in the U.S., it's slides of the U.S. And if you just keep on clicking the years from the 70s until now, or at least 2015, you'll see how the obesity wave of colors has changed the landscape of the United States, and it's terrible. By the time I hit 60 in 3 years, it'll be 1 in 2 Americans. So being too skinny is going to be going away. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So there is a problem with having a low body mass index. And I'll use body mass index, BMI, because they're, aside from the scale, which the scale is good as a metric. You know, you step on the scale, every scale is a little different. Some people weigh with clothes, some people weigh without clothes, some people weigh before meals, some people weigh after meals, beginning of the day, end of the day. So there's a lot of variability. And the variability could be plus or minus 5 pounds, depending on your hydration state, if you're fasted or not. So I think there's a little bit of inaccuracy. However, in the long run, honestly, if you use the same scale, if you continue to use the same technique when you measure yourself, you can use those metrics to see if you're progressing. And then ultimately, if you're overweight or obese or morbidly obese or underweight, you just want to track that number and then fix. Now the question is, how do you fix it? No, even before that, the question is, do we even have to fix it? So my guy, Bharat, and in fact, off the top of my head, Andy, they both look like marathon runners. And that's a gift. Again, that's a gift now because in today's society, they're the outliers. So, is it healthy to be low body weight? It depends. So altogether to be skinny, this is why I consider myself skinny. Still, except now between middle school and high school and now, I've been able to attain muscle mass. So the skinny thing is, or at least the critiques are kind of low priority. The new critiques are that I am wearing tight shirts. So I talked to my patient the other day and we were just teasing, but I've had some of my colleagues say, why do you wear such tight shirts? And the reason I wear tight shirts like this is because I'm skinny waisted. Again, I'm skinny, but I have some muscle mass. So the problem is if I wear a shirt that is fitting here, it's going to be tight up here. If I wear a shirt that's fitting here, it'll be like a big blouse down here, and I'll have to gather up all the excess and tuck it in somewhere, which really looks disheveled. So that's why I don't wear ties and nice shirts. If I wear suits, I just wear t-shirts. Anyway, so that's a big deal, right? Who cares? However, again, it's the outliers because I can't even find an athletic build. So there are problems when you try to fit clothing for obese. There's also problems when you try to fit clothing for skinny or low. This is called low BMI. So getting back to where I was talking before, sorry, I just rambled there. But the problem with having a low body mass index or a low body fat level is, number one, that's called sarcopenia. So when you're young and you're skinny, meaning low body fat, and you have no muscle, I guess that's okay because we see kids that kind of grow up that way, but usually has hormones take off in your late teens to 20s. The hormones will put on protein synthesis, and as long as you do a little bit of exercise, you'll start to put on a little bit of mass. So your BMI will notch up forward. And again, I'm just using BMI because it's the easiest measurement without having a bod pod. So there are other, before I go on, there are other ways to measure. Fat calipers are the old-fashioned way, and fat calipers have their errors, and they don't measure, they measure your extremities and some of your belly, but they don't measure the visceral fat. That's the fat in that omentum inside the belly that gives you, some people, a big pouch in front. So it's easy to apply, you can do it anywhere, essentially free, but the formula that you plug the thing into and the subjective error with people doing different areas could give you some error. Again, if you're using it just as a metric, okay, but use the same person, use the same areas, use the same formula. There's also BMI, a body mass index. I'll put a link down below for my previous video on BMI. There's a bod pod. They used to do this at Benedictine University, where I was a team physician for a while. Well, it used to be Benedictine College. Then when it changed over to university, they still have an exercise physiology degree that you can get there, but I don't see them doing bod pods anymore. There's also hydrostatic weight when you get in a dunk tank and you displace water. That's also good for looking at your density. The bod pod displaces air in its container, and it also tries to get your density, but both of these put you into a formula and then they try to calculate, so it's a little bit of error too, especially between bod pods, different universities. Then there's the DEXA scan, which I think, for me, it's the best, it's easiest. There is some radiation involved, but it's very low amount of radiation. However, again, anything you use, you want to have the most accuracy, you want to have the least amount of side effects, and you want to use the same place. If you can't get to the same place, you want to at least use the measurement that has the least variability, so you can measure, and then you can take another metric measurement, and then take another one, and you can see if your efforts have progressed. That's what I do with my clients and my patients. If I'm trying to change lifestyle, when you're morbidly obese, it's sometimes difficult. I can have patients that have sarcopenia, meaning no muscle mass and a big amount of fat. And when we lose the fat but gain the muscle mass, the scale will look exactly the same. And they'll be, at 3 months, they'll be like, what's going on? I'm not gaining anything. So I'll ask them, what is the waist to hip ratio? Because we can measure waist to hip ratio. That's nice to know with these numbers. And you can say, okay, well, listen, you're actually gaining muscle mass, you're losing fat size, muscle is heavier than fat. I'm just going like this because of shoulders. Muscle is heavier than fat. So when you grow and you decrease in size, the overall weight on the scale that you're stepping on might actually be the same. So we take a couple of different measurements, so don't be discouraged. Because unfortunately, most of my patients that have obesity will also have decreased I'm not going to say poor, but decreased exercise tolerance because of pain, arthritis, or just physical deconditioning, and it would be helpful to grow muscle a little bit or to stimulate muscle. And just by default, most people who are overweight usually did not participate in some form of activity when they were younger. So you had low muscle mass to begin with, and then you gained the fat, the suit of fat later, and it's going to be tough as nails to start the muscle reactivity or the muscle growth at a later age, in perimenopause or menopause, when the testosterone and estrogen start to decline. But it's still better than late than never. So I really think that if you can get muscles moving, type 1, type 2A, type 2B, especially type 2B, that's the power. I just love power development. You still have to have endurance with the 1 and 2As, those are the fibers. But it's nice because most people who don't have exercise tolerance, and lactic acid tolerance is really terrible. If you develop these guys, you'll have fat burning factories in your own body to accelerate your fat loss. But you got to get to that point by having a trainer or somebody like me teach you how to exercise. So just realize that I go back to where I began with this thing. The most important thing is to watch out for side effects. Side effects of measurement and side effects of just being low BMI. So this is my DEXA scan. This is how the DEXA scan looks. It measures your total body fat, and muscle composition. It does give you a measurement over here about percentage. I think I'm estimated fat of 13%, somewhere over here. And then compared to the US, I'm at the top 1%, which I guess is pretty good, as long as I'm not sick. And there you go. So that's the issue. The side effects, here's the big spoiler. The side effects of having a low BMI. Number one, it is found that during times of influenza, especially Spanish flu, the people who would die first, massive amounts of people who would die first during the exposure, would be the people that had the lowest body weight. For some reason, low body weight individuals seem to have a little bit of an immunocompromised state. Now, again, that's from old statistics, but that is one problem. And I have seen some of my patients who have low BMI and no muscle mass, super skinny, don't exercise, just have or totally stressed out. They've either maintained not eating so many calories, which is usually the biggest problem in the United States, or they are just totally stressed out and skinny. Anorexia is a different thing. I'm going to handle that later. But these two folks, they will usually know that they get sick a lot. So when you have somebody that's skinny and they get sick a lot, you can guarantee the immune system is probably compromised or struggling, or they're just too stressed out. Either way, if you have a pathology and you know what you have to do, fix this, then you might be able to improve your immunity, getting sick. So I really think that if the white blood cells in the body have a really good responsiveness, they can attack anything, including cancer. Now, you have to back all that stuff up, but that's just in my clinic as far as anecdotes. The other problem with having a low BMI as you get older is muscles don't have to carry as much of that soot. So that soot, in fibromyalgia, it's called a soot of concrete. In obese, at least in my obese patients, I call it a soot of fat. So when you have to carry around this suit that's sometimes 200 pounds, you have a lot of stress, and your joints and your bones have to constantly get impact all day long. Even if you don't exercise, if you're just moving, you have a lot of impact. So the bones in an obese person usually are not osteopenic or osteoporotic. Osteopenic is just that you're a little bit less dense than the average person. Osteoporotic is when you're pathologically, the bones are not only less dense, but on their way to a fracture. You sneeze and you fracture a rib. You miss a step and fall down. Next step, you crack your backbone. So that is terrible. I had an old nun that was about this tiny, and she was on steroids forever because of her asthma. Is my patient back in the 90s, and she was severely osteoporotic. But every winter she would have an asthma attack and cough, and then break a bone, and then she'd have to deal with the asthma, the bronchitis, and a fracture every winter. That was just a terrible way to go. So, and then not only that, people who are osteoporotic also are high possibilities for hip fractures or hip replacements. So it is a problem, and it's not just taking calcium. In fact, people who take places in the world that take calcium to offset the osteoporosis usually have a higher fracture rate. So it should be real food with real calcium in it, whether it's vegetable or meat. That will get you a building block to fight against osteoporosis, not taking calcium. Vitamin D is important too, but I'm digressing again. So we have immunity, we have osteoporosis, osteopenia, and finally, I think that when you have muscle, this is just, so those two are the biggest, but when you have muscle, it just makes every system work better. So if you're skinny without muscle, you could be looking at hormone deficiencies or imbalances as you get older. Sometimes if the body senses no fat and no muscle, it might think starvation. And again, this is not data driven, but I find that usually my excessively thin or too skinny people might have to be worked up because they have thyroid abnormalities. So the thyroid is this little gland here. It's a little bow tie. It's supposed to be stimulated like the adrenal glands and the gonads by the hypothalamus, or the master organ of the master gland of the brain. So as you get older though, sometimes with constant bombardment of signals to the brain saying, I'm not hungry, I'm not eating, I'm not full, my glycogen level is low, my fat level is low, the brain will say starvation. And when it says starvation, like in fasting, it shuts down all unnecessary hormones. In the case where you're supposedly sending messages to the brain, I'm in starvation for a long time, it shuts down and decreases every hormone for a long time, and it makes it very hard to turn on again or re-stimulate. So that's when you've had accumulated damage and you can't get the gland back. So that would be hypothyroidism. So underactive thyroid, sometimes you'll have hair loss, you'll have constipation, have depression, you might have problems with acne. You could have weight gain, but again, it depends on the reason. And if the initial reason was too skinny, then you might have skinniness and you'll have a problem with excessive muscle loss. Because when the body decides to shut down in times of starvation all of the unnecessary hormones, body's not going to care about muscle, it's going to care about survival until the next crop comes or the next season comes. So it shuts down everything. It's kind of like a train. If Walter Longo had a nice analogy that if you have a train that goes from point A to point B, and in the midst that runs out of coal to burn, the conductor will burn everything else in the train to make it to the next station. So you'll burn one of the cars, you'll burn some seats that are wooden, you'll burn anything, tiles, just to progress on and make it to the next station. So if the person is thought to be in starvation mode, the body will do as best as it can to shut down any other activity that's unnecessary, like sex. Sex is not a necessary thing when you're in starvation mode or when there's famine. So hormones get decreased, and if you get hormones decreased, again, nice hair, nice skin, that's all gone. Sexual desires, all gone. Erection, vaginal moisture, all gone. So until you get to the next feast, when the next feast comes, that's called the refeed cycle, then everything turns on again, stem cells blossom, you fight immunity, you can reset your autoimmune levels. So that's why it's nice to, if you are doing a fasting diet, it's nice to do the refeed just as important with not just indulging in fat stuff or crappy food. But the same thing with skinny people. If you are not eating because you don't have an appetite, it'd be nice to get blood tests to make sure that we have a baseline on how the hypothalamus is doing. Sometimes IGF, insulin-like growth hormone can be tested. Thyroid full panel can be tested. That's not just TSH, that's TSH, free T3, free T4, reverse T3. Sometimes I'll even get an ultrasound, and then cortisol and the DHEA, and then the gonads, whether it's estradiol, estriol, progesterone, testosterone, random insulin. All these things are important, but you have to make sure your insurance covers those things. And you should snap a picture of blood tests right in the morning. So for those of you who are interested and can afford this test, get it in the morning at the usual time that you wake up without being stressed out, fasting, no coffee, and just water. See what those blood tests do, and then take another metric. If you can get saliva, it's even more sensitive because you don't have to even get out of bed. You can put your saliva tubes in. They're pretty accurate, but not covered by insurance. So neurotransmitters, not necessary, just those things I mentioned. So other problems with low body mass index, finally, it does not lead, becoming skinny or being skinny with a low BMI, again, I'm going to use BMI for ease of low BMI or a low weight, does not lead you to anorexia. So I just wanted to make that statement. So in women, it's called anorexia, sometimes bulimia. In men, body dysmorphic syndrome, which is a little bit different. Usually that entails exercise and constantly exercising and seeing your body image as perverse or different than what everybody else sees it as. So the DSM-5 has different ways to define anorexia, bulimia, and body dysmorphism for men. But usually if you have those problems, you can have a too skinny level or a low BMI or a low body fat. No, I shouldn't say low body fat, a low weight on the scale. So it might, for the clinician like me, it might be a red flag depending on how I see the mood of the patient. But if you've been skinny all your life and you continue to be skinny later into life, I'm going from youth to age, as long as the clinicians keeping that in mind, we can rule out a mood disorder or a DSM problem like anorexia, bulimia, or body dysmorphism. So it's still something to keep in mind, but just because you're trying to get skinny doesn't lead you to that point. And then usually, if it's not pathologic, it's okay, but I always have a counselor kind of get their eyes on my patients. And if you increase, I think, the coaching team, you'll have enough people or eyes on the individual that's making the change, whether it's to gain more muscle mass, to put a little more fat on, change nutrition, or get better sleep, or change jobs. You'll have several eyes and a bigger team to make a better adjustment. So Bharat, as far as the question of being too skinny, there's never a problem. If there are associated problems with you happen to be a little bit too skinny, then I'd say it's a pathology and we need to work it up. Although, a good question. For those of you who know skinny people, please pass this on and give them reassurance. Maybe give their parents a little reassurance to say, calm down, stop bugging the guy to eat. That's what I used to hear all the time. You got to eat more. Every time I went to a party, you got to eat more. But here I am, and I'm probably I'm the top 1% of the population of America at this point in time, according to my DEXA scan, which is kind of cool. But still, I have my things I have to work on to be. It's not a matter of looking good. It's a matter of longevity for me, for my patients. I don't want everybody to be as skinny as me. I don't want my young people to be massive, swollen. The idea is longevity and avoid the morbidities of the standard American diet, and that's all with fine-tuning and personal prescriptions. So thanks for watching until this point. Otherwise, subscribe, and I'll see you at the next clinic.